Good afternoon. It is Tuesday, November 30th, and I'm called to order the work session of the Board of Supervisors for the American Rescue Plan Act funding. Yesterday we were going through the applications for external ones and garnering questions for whether it would go back to the agency or if we have questions for ISAC or other entities on there. I believe on our list, so may have to correct me if I am wrong, we were doing housing, and I think we were up to number 30.
Yeah, we just finished 29.
That's what I have in my notes.
I have this. Okay, I just didn't want to block it.
Just take a moment to pull. Questions. My one that came out, and just because I don't know, but I'm not a builder or project manager on it, the application referenced that looked like 2 of the units would be ADA compatible, but not all. And I just don't know what building codes are on to what extent something needs to be that ADA accessible. That was my only question when it came to that. When you're doing, what is it, renovations, what falls under that? And it may meet the requirements. I just, as I said, I'm not a builder, so that was my one question that just stood out.
And before we get too far in, just kind of like yesterday when you were talking about Micah, I am on the Story County Housing Trust, and we have talked about this project before, so I just wanted to kind of put that out there too, that I'm familiar with this through the Housing Trust.
And I guess my question on ADA would probably be, and I'm gonna assume that all builders, whatever they do, I mean, any of the infrastructure things that we're kind of looking at have to meet this, again, the ADA criteria. I don't know what all that involves.
I would assume there wouldn't be a need, but that doesn't for all of them should be, but I don't know what that means. They have to be or not.
Oh, if they all need to, you're right. I don't know either. That's why I just recognized that was just my one question on that.
I had a question that was similar to the one before it. This is for construction. And it's also for subsidizing the apartments, which the subsidizing part, I didn't have questions about what the construction is. So still, I need to get that ironed out. Also,
So what was your question? You said you had a question on that, the construction?
about construction, whether or not it's even eligible.
Oh, just in general question on.
Right, right. And also consistency with the housing action plan, since the board is already working on its affordable housing goals. ending date, I also had a question about, the milestones, it references June 2025 and beyond. I didn't know if it was ending, if it would be completed within the time frame or not.
So the and beyond question is what,
Right.
yeah.
Right.
And so my question is also, the project is still looking for full funding from lots of different sources. So where exactly is the project as far as being funded or not? How close does this request get to reaching their full funding goal?
Is there anything about that in the budget? Well, it's 458 is a bank loan.
Right, which is the getting kind there.
They've raised 98.9 out of 318,000. Donation. Okay, so our money is included. Included in grants and donations, 318,000, correct? The ARPA money that we got. $458 and $318. So,
That's how I would think about it.
yeah, so there's about 220 other, I guess, would be the 318. Raised 98, so there's 220 left to go. They've asked us for 68. Maybe other one that's been raised, but we can't go through that. So how much more?
So were you asking another question?
No,
Okay.
it's, the question is just how much more do you need to raise to have it full budget?
Okay. That's all for our housing ones. 32. Oh, I'm sorry. I was actually having my finger right on it. So, right, 32.
Again, I'm on the story planning trust, so. But I haven't been involved in anything past the very first conversation.
The homes for Iowa home, I didn't understand how they got to 250,000. We had done some back of the envelope. It came to about 170 total. No, I have not just. Here's the homes for Iowa pro forma. They had a whole bunch of things that I didn't get you had to Like the cabinets, I thought these came with cabinetry. It's just a whole lot of money. I was surprised I got it up to 2,000. Maybe there's things that I don't know about.
Is that a basement?
Well, it's hard to tell because it's the way the description of work is. It's like concrete. It's got rough carpentry, 75,000, and I don't understand that. Unless that's a finished basement. I don't think there's any carpentry involved. I guess I just we need to ask for detail on that, just how to. Unless you're talking about the garage.
Garage and driveway. Garage and
okay.
driveway.
Okay. I was just surprised at that cost. I don't know how to.
I also had a question on the direct care recruitment stipend. So is that stipend going out to clients? Well, they have in their budget, it's in, they put in 110,000 request direct care recruitment stipend.
I believe that is helping employers subsidize housing for their employees. I'm not 100%
Yeah,
sure.
I'm the description of the program, direct care voucher program. Award all funding on a first come first served basis. That's in their project program timeline and milestones. I'm just a little unclear.
On page 12, it talks about recruitment will provide a stipend every month to help cover housing costs. So they're covering housing costs for their employees through the stipends. That's how I read it.
Yeah.
They're getting people to work for them because there are stipends for housing to come and work and live in the city. That's kind of what I read it as.
Oh, so stipends for
Through their employer. So it says the stipend will be provided through their paycheck by their employer. So it must go to the employer and they pass it through to the employee. Is that how everybody reads it? Yeah.
So it's direct care and child care and other employers. I think that we know that child care is having a hard time keeping employees. We know the hospitals are having a hard time keeping employees. I'm concerned about the other employers, how far that would go. And what would, how would they decide what employers? How would they decide who the other employers are?
Yeah.
Is that what you're looking, you kind of nodding?
Well, I think they say it right there. It's first come, first served. Where did they say that?
Yeah, it's back into the program
In the timeline.
in the timeline.
Yeah. Is it tied to the income of the employees?
I
Because it says eligible employees, so I would guess there would be an income threshold to get the stipend.
So it's employees who are building the homes that this would go to, or
Employees that are working childcare or direct care, they would get a stipend to help with housing costs, is how I read it. Paid to them on their, through their paycheck.
so I'm just trying to figure out, it's not really like, I'm just trying to figure out for the others when we've looked at things that are just like additional pay, kind of like the one with Micah with theirs, how does that?
This isn't wages, this would be housing assistance. Like it's a
So, but if
recruitment
it goes to their
tool and a-
paycheck, that's where I'm just trying to figure that out, so.
Goes to their paycheck.
No, well, no, that's,
I'm guessing it's taxable then.
so I'm just trying to figure out how then is it identified that it's not a wage, and then it's going towards housing. That's my like, my question, how,
That they can use it for anything once it gets. in the
right,
paycheck.
right, that's what I'm unclear about.
Oh, that they could just go to anything now.
Right,
Because they're not paying the landowner for the housing.
Well, we would want to guarantee it with housing.
right, and that would be my question is, if
How
we're
would you
saying we're
guarantee-
not doing extra pay in other areas, or we're looking at, would we want to do extra pay in other areas? Well, this may be directed for housing or childcare. How do you assure that, and then how do you track that? I guess would be the question.
How will you guarantee the money goes to housing? How will you choose the employers to determine? That first come first served bothers me. I mean, okay, the goal is that how do I say this? Are there employers out there who could afford to do this? I mean, what if it goes to an employer that's a very profitable employer? See what I'm saying?
It's a pass though. Correct?
You
I mean, what if it goes to an employer who could afford to offer a housing stipend, but yet
Yes.
they're choosing not to because there's
Yes.
this funding is available, whereas there's another employer who does not have the ability to do that.
What problem are we trying to solve? This is really the question of this one. Are we trying to get more employers for childcare, for employees for childcare? They are in direct care. And this is a way to do that. I'm, it mixes up too many things. It mixes up too many goals in my mind. I'm trying to sort through it. But yeah, I don't think that yeah, maybe I just have to say it that way. How many- Some employers, what if some employers can afford to do stipends on their own?
How would you know that?
Well, maybe you look at nonprofits. Maybe you don't look at for-profit. No?
Maybe we
Yeah.
don't need to solve that problem for them. Maybe we just need to ask the question.
Yeah.
How,
Or you. I'm not even sure the question.
What problem are you trying to solve?
Well, that's my question.
I would just ask that, what problem are you, what problem are you addressing specifically with number 2?
Doesn't go to employers.
Because I think what it's trying to do is support those industries that we know were hit the hardest, while also helping with housing, like help those industries keep their employees or recruit employees by helping with housing. But it's kind of a little mixed up in there.
yeah, and I guess I'm a little confused by number 2. And then it says that you will work with direct care, childcare, and other employees to promote the home buyer program. So again, is this kind of like a, I don't want to say bonus pay, because that's not the right term, but additional pay to help promote that program? Or is it additional, I mean, is it they've identified the person who's needing a housing assistance? and then you have to identify who their employer is. You get, I'm a little confused by that, because this is,
Sounds like they're trying to check multiple boxes.
Yeah.
yeah,
So not only are they getting the $5,000 first time home buyers, if they also work for certain employers, they get monthly stipends. I don't know.
I don't know, I'm a little confused.
That's
by
kinda how I
too.
read
I'm
it,
just-
And I suppose that would help with defraying the monthly cost. If they don't feel like the $5,000 is enough to. I mean, it helps, but it doesn't help necessarily on a monthly basis with the
Yeah.
mortgage, so. I think number two is trying to say that they're going to target those industries to promote the first time home buyer assistance. So trying to be targeted with their marketing efforts to this group first.
Right, and that says from item 1 and the owner occupied repair program currently offered for eligible workers currently employed. So I guess that's where I'm confused. Is it just those individuals that are currently employed? But then this is for recruitment. I'm confused by number 2.
It's just the-
Yeah, exactly.
clarification.
Who are you targeting? Who is this targeting? For those additional funds, and if it's going through their paycheck, how are you guaranteeing it's to cover housing costs? And I know housing costs can be pretty broad, you know, food, heat, electric, whatever.
But if we're gonna say it's for housing costs, then we need to show it's for
Housing
housing and
costs.
not.
Sure. What if somebody's living with a relative who isn't charging them any rent and is collecting this money? Example, right?
Right, yeah, I just,
It could be done, yeah. Some, they're working on the housing costs. I'm not sure if I got your last question, Lisa. I'm
Oh,
trying to keep track. of
yeah,
it.
sorry, I think my question, and you may have, I was just trying to figure out in number 2, is that identifies both the direct care, the child care, and the owner occupied repair program currently offered that are eligible workers or employed. So I was trying to identify, is that stipend going to which entity? Is it the current one's employed? Yeah. Sorry.
That's fine.
No, thank you for shutting that. Yeah, I was just trying to figure out if it's going to those current eligible workers that are employed to help defer housing costs, or is it going to the others if you're reaching out to help promote the program to direct care or child care?
Sort of money go to current workers and recruitment workers.
I just think overall in general, I'm just confused by number 2.
I think you're trying to say too many things
Mhm.
in number 2.
Anything else with,
This consistency with the housing action plan and goals, affordable housing goals.
so does it meet the consistency with the housing action plan
Is it
and
consistent?
and with the county's housing goals? Did you say?
If it fits with the counties, the boards, affordable housing goals.
Okay, fit with the county's affordable housing goals.
So the same thing we asked in the previous one.
We're ready to move on to next. So I then went on to what I thought were infrastructure. So I had number 3. Okay.
We did not talk about.
I don't think so.
Okay.
I went through my notes too, because I kind of thought, but I think that was one we decided. This is the try. This is the Boys and Girls Club one. They have a number of things that they were looking to use with their funds. Provide after-school academic support programming, install fiber optic, remodel and expand their kitchen.
$200,000 for the $500,000 program personnel.
For 4 years.
For 4 years, yeah. I think my question on that would be, is that new personnel?
Right. 4 years is probably one staff person.
But is it,
Changing the funding source or
right, is it changing a funding source, or is it for a new?
I don't think it said it was new staff, but if they're expanding their program, I would anticipate new staff. But
Adding a dedicated development person to our team.
Where did you see that?
Page 10. This is an ongoing project with sustainability, our current strategy for online program support, including adding a dedicated development person to our team. This individual will assist with fundraising.
so
That's
how does
fine.
a fund development person relate to the? I mean, it's got to,
I think that's just answering the question about ongoing funding for the project, for what they're doing.
so this person they're adding is not the development person.
Well, it says adding a dedicated development person. But is it,
that's how they would fund it in the future.
right, if they would do the
Fundraising.
fundraising to do that ongoing?
So I don't know.
I
if
guess
that
my
200
question when they were
Yeah.
talking about
Yeah.
expansion, what was it? With, I guess when they had in their project purpose, and it said they were, it said provide after-school summer support programming, which they already do, and I know that they, I guess I kind of looked at, with that phrase, and then would they be looking for someone directly to work with the kids, I guess, versus someone else who looks like they'd be, I'm not quite sure what the development person is, that to help develop the agency and fundraise for sustainability versus someone who is providing direct funding. Working directly with the kids. I think that was my, I was tying that back to that first sentence. And maybe it's intended to be separate. Just in my mind reading through it, that's how I connected it.
So I guess, is it 200,000 for 4 years for a program person or a development person or something else?
Yep.
You see the kitchen as being fundable?
Molly would raise the similar questions as new construction.
It's food and security. That's
Right,
what they're using. Yeah.
right.
Yeah.
So I guess my other question, would they be? Will the project be all completed by 2026? It looks like fall of 2022, they're looking to seek funding for a remodel project.
They put yes,
Yeah,
or they marked yes, I should say.
right. Any other questions? Anyone else have on that one? I can take a little time before we move on to the next
Or
one.
the construction and remodeling eligible expenses, is that what you were asking?
Yes, remodel, the kitchen remodel. It's the same type of question.
Next one I have for infrastructure was 11.
Well, again, it's a new building. Is construction is eligible?
I saw this one as an eligible.
I'm sorry, what did you say, Sandra?
I saw this one as an eligible.
I do know they need more space. For their current, where they're currently at, they definitely need more space to be able to meet the needs and to, Just-
Update.
yeah, just update, but just like thinking capacity wise. I think they're kind of limited capacity wise because of where they're located at. It's seeking the clarity on a whole new construction, building construction.
Yeah, they say they'll have more room, they can provide more services.
Right.
Understandable, but I don't see the time. There's some good statistics, yes, older populations were more impacted and all of this, but we're more, are getting older, but I don't see the tie specifically to the architect criteria. May not be eligible.
Yep.
I don't think I have any specific questions for them.
The next one I have on my list would be 19. Child service expansion project.
I had the same concern that it's building
Did you have?
No, I was just looking at, just kind of doing a quick review to see if I had any.
I guess one question I would have for them is how many positions do they have that are unfilled right now?
Did they talk about capacity in terms of staffing needs? They said that there were longer waiting lists.
Right.
So the physical size of their facility is prohibiting the growth of the organization, to serve more children. So they didn't say anything about staff. They just can't physically house. That's what I took it as, but
Anybody know when they last did any building in that facility and expanded it?
It was built
Probably
in-
15 years ago and it was fenced in.
Yeah, because it said it was built in 2000. Like capacity for 20,000 square foot addition to the existing structure, including parking and green space. So,
So the concern is that it may not be eligible. So,
yeah, I think, yeah, we'll have to. So,
25 next.
yes. The 26, weren't we just on 25?
We're on 19.
Oh, I'm sorry, yes, I'm sorry, yep. Yes.
what number was it again?
25.
This one had 3 projects. My
Right.
question was about the first one. Construction. Purchase. Remodeling costs.
I'm sorry, Sandra, I couldn't hear you.
Purchase of the home and remodeling costs. I'm concerned about that one, but not the other two.
They, their 2 and 3 aren't consistent throughout the application. The point air filtration is their third purpose and the other one is their second. Just-
And because this would be housing, meaning that, so your question is more the in general, Sandra, excuse me. Because we do have some applications that have been housing application, I'm just trying to figure out how to make sure we're being consistent in kind of our discussions or deliberations. Versus land acquisition or a whole new build. But we talked about housing, I guess that's just my question on there.
And this would included purchase and remodel, was my understanding of it. Purely purchase, I'm
Yeah,
not sure
yeah,
about
yeah.
remodel. I didn't think that was eligible. The other two projects, I thought I didn't have any questions about those, but it was just that.
Sure.
Just a
Yeah.
So the air filtration is eligible because it mitigates the public health.
Right.
And the lift and track systems are eligible. Why? Under what?
Well, according to what they say, helps to ensure that high-risk individuals who are more susceptible to illness and injury are in the safest environment possible while still being an integrated member of the community. And it's these
Housing.
See, I didn't put this one under housing because I felt like there was so many things, but you're right, it is also housing.
Right. And I would agree. It's just that one section, because there's three different things that they're looking at. So to me, it's that one section they're talking about housing to a high need or population. And I would almost assume, if they bought something to renovate, it's because they're gonna have to make it accessible for the clients that they serve. So
What's the summary of what you've heard with all our questions we've asked about capital expenditures? Do you feel like you've got a good handle on it?
no, not as clear as I would like to have. That's why some of these questions from what we had yesterday, I've kind of noted are ones to go back to ISAC for. We definitely have some that are going directly to the agencies, but yeah, some of these capital ones that are separate, those ones I'm definitely going back to ISAC for further clarification or guidance on those.
I think there are other issues with construction, remodel, and those types of projects that can have a delay beyond someone's control that could take it out past the date that we're supposed to be our deadline.
Right.
And so I'm not sure if the guidelines indicated that, yes, these are eligible and the board decided it wants to fund some of these, what would happen if we got to that point, they were into the project, but determined, yeah, it's going to be a year delay, and that would take us past that deadline. Would the county have to pay that money back? Or how would that work? Is that one of those types of risky projects that
If it's not committed by 2024, we'd have to pay it back. If it's not used by 2026, we'd have to pay it back.
That would be my understanding.
That's my understanding. That's my understanding too. I think that would probably have to be something that would be in a contract that say, if this goes beyond, I'm assuming there would have to be then some liability on the agency to take that on, and that would have to be part of the contract versus us trying to figure all that potentially out now, because I think anything could potentially be delayed.
And because we have such very, very different kind of projects, the contracts aren't all gonna look the same.
Right,
Because they
right.
may have different needs in terms of when they get money or reimbursed or whatever. So they're gonna be pretty specific to
Right.
each application. I'm afraid.
I think it adds another level of risk. I guess that's what I'm trying to say, that it's more high risk. And then with the challenges with construction costs and things like that, it sounds risky. So
Sure,
additional consideration. I guess.
Any other additional questions for,
Guarantee that the project will be done on time.
right?
Questions about construction.
And I have 26 is the next one to go to, primary health care.
One of the things was money to help pay their rent. What's that? 164.80.
Oh, yes, I see that.
That's for a year. Isn't that already in the budget? I can't see how we.
Yeah,
Pay your rent, I mean.
right, right.
It isn't for more space, is it?
They want to renovate. So,
Adding to staff.
Yep.
Some more equipment. Modification of physical space to make room for 2 additional team members.
We have some equipment purchases too. Pediatric dental equipment.
right, the pediatric dental,
It's also buying smaller furniture so that people could share an office. Buying office furniture.
helps to mitigate COVID.
It doesn't, because goes the other way.
Right, right.
Yeah. So they got funding for the dental clinic that used to go to Micah.
Right.
Was it not sufficient? Not-
Referring to the rent, Linda. What they're asking
No,
for
they're
rent.
asking, they're expanding access to dental and medical care. According to their purpose.
This is the first year that we would get.
Mhm.
And as they explained, in that same area, but they talked about rental assistance, they talked about location census, many more self paid patients, challenges with staff, expensive PPE, and the concerns maybe that they didn't take into consideration. But this is really the first year that they're.
Right.
It's just fun.
Well, yeah, when those funds transferred or reallocated to primary health care, that would have been pre-pandemic, was it not? I'm just trying, because you wouldn't have, they probably wouldn't have calculated in at that time these type of needs. If it were pre-pandemic, you wouldn't be thinking of, oh, I'm gonna need this.
I'm thinking that it wasn't FY 20 or FY 21.
Yeah, I just don't remember when that.
Yeah, maybe they were having a little.
And the two new staff are for the dental side or the medical side?
Just the medical side.
Once the health benefits specialist.
So we kind of cover for all.
Right.
The other was a clinic operations specialist, so it'd be patient registration. Maybe
So it would be all as well.
I think
So
so.
that would be,
what it appears to be.
okay.
Basically about continuing to pay those people. In those positions.
They didn't. That box is empty. Oh, it's not a bill.
Right. And that's what-
Positions should be self-sustaining after year two as our volume shifts to returning more patients and less new patients. So they think the positions will be self-sustaining after 2 years. That's what
What
it
page is that on?
says. It's on page 10 at the top.
Yeah, I had blank there, but then I clicked something and all of a sudden it popped up.
Yeah, it was blank before.
Yeah, yeah. But you said you were seeing it on the top of page 10. I was like, well, I'm seeing nothing there, so, okay. I know that they are a federally qualified healthcare center. Do they, just because I'm not sure their funding, do they just get a set amount like each year or for 5 years or however it is? Or does it take in, do you know, say, does it take into consideration like their census, their volume? Does the amount that they receive get kind of recalculated, or is it just a straight? This is how much, no, from the federal government. Do we know how much is just kind of a straight, is it consistent each year, or does that fluctuate? that, how that works? Yeah, I wasn't sure. Right. Do we have any questions, or what do you have down on the first questions for our
What do I have
conversation?
so far? Just a second. Not a lot. Included 164,000 for rent. Isn't this already budgeted, or is this new space?
Yeah, 'cause how I read it is they were asking for rent because they had unexpected expenditures of PPE and
Stuff.
COVID testing and
So
other things.
So it's because of budget shortfall.
Yeah,
They wanted
that's
to
how I-
offset their expenses. is
Right,
what they
right,
stated.
that's how it looked, is that's what they're trying to do.
Yeah.
Sounds like current rent because of budget revenue shortfall. Is that the case?
Weren't there options for medical providers to get assistance with PPE and all of that through the federal government? And why didn't they take advantage of that?
They might have, but maybe it didn't cover everything. I don't know. I'm wondering if,
It may have with the volume of people that they see and both, both their clinic and.
they just might have covered a portion of it. They still had a lot. I mean, I don't know what funding was
Did
out
you
there.
have more costs for PPE than were covered under federal programs?
Yeah, what was the federal PPE program?
It's the first-
CARES.
CARES.
Yeah, it was the CARES Act, wasn't it?
CARES.
Did you receive any CARES
Yeah,
funding?
did they receive CARES funding, I guess?
I would think they'd be eligible.
But did they apply?
Did you apply for and receive CARES Act?
Construction component.
You have questions on the construction component?
Eligibility.
That was-
General eligibility,
General.
construction.
These are what you call infrastructure.
Yes, that's what I prefer.
So is that, did you have more?
I did, I had 34 and 35. And then after that, I put the rest under kind of the catch-all category.
I did too. Not on the sheet. Okay. So Latifa, did you have anything, or did anybody else have anything else on primary health care?
No.
Thank you.
Thirty-four is one of the ones that, Lisa said she was struggling to find an expense category that was put into.
Just gonna say that. I had it flip as well.
Stay on then. Addressing negative economic impacts.
It's more outreach. Is that how you're reading it?
Due to the negative effects of COVID-19, we're unable to meet with city officials.
Yeah, so if you read under the next on page, describe the project goals. looks like it's more for personnel. And then,
It's not, I think I understand the application. Very good, this is an agency, and I'm not on their board anymore, I will say that. Okay, I've been on their board. But they are an agency that really works on grants primarily, and they're always going away and having to get others. Kind of, they don't have many long-term sustainable funding sources. The budget detail shows is three existing reports.
oh, okay,
So it's time of those people, and one of them is 2,079 hours, which is for 2080 is how yours budget. And that's one FTE, so. I'm just not sure what this eligible.
yeah.
I like it. I think it's great. I think it's great for water quality. But I don't see that it's an eligible article.
I wasn't really sure what the link was either. Question
And
mark.
I'm having a hard time hearing you, Sandra.
I wasn't sure about the link to the pandemic, the negative impacts of the pandemic, so I put a question mark by that one also.
Sure, sure.
I just took it, they couldn't get out to the places because of the pandemic, so. they're
Right,
behind.
they could speak with, they could.
Yeah,
they-
that's how I read it.
But now that, yeah, but they're needing 94,000 to be able to do it.
Yeah, the project didn't seem to be related to their inability to get out. I wasn't sure about that.
Okay.
I think it's not.
But
I'm kind of leaning that way. in my thinking.
next one is number 35. They're doing a couple things. It looks like renovating part of the theater, but also remodel the upstairs apartments.
Really small print. Doesn't look like the apartment renovation area they requested apartment plans for.
Asking the rent assistance. my one question would be, what's the rent assistance goes towards in our budget request? Rent, it says rent, 25,000. That apartment rent, is it?
I'm assuming that there's two budgets.
Well, maybe I'm looking at the wrong one.
Well, I don't know, there's a project budget and a reservation budget and a Main Street budget, so that's kind of confusing.
So, I was thinking of the general application.
Budget is 743. Everyone's in. So there's the project budget.
So, I'm a little confused. Oh, I mean, no. Okay, never mind. It was trying to look across and not having it lined. I was looking at the wrong amount requested on the sheet here compared to what was here. Answer my question.
So are we looking at the theater project budget or the theater renovation budget?
Why don't we start looking at the theater project budget?
So the art request would be windows, brick repair, there's
Guess I tried to look at stage renovation. How does that meet? How does that connect with COVID?
I think that the general thing is the economic impact that it would bring business.
So
More businesses to downtown Nevada. I think that's it,
that, okay.
which is kind of a general economic argument. I don't know what more see to say it's related to COVID impacts.
Sure. Just meets that
Address
overall.
negative economic impacts caused by the public health.
It's unique because it's one of the only tourism type applications that we have.
Yeah.
Mhm.
You look under the, I don't know if you have the FAQs, at 2.9. Page 6. There's a statement there of For example, the recipient may provide aid to support safety of businesses in the tourism, travel, and industries. Into districts that were closed during COVID-19 public health emergency, as well as a planned expansion or upgrade of tourism, travel, and hospitality facilities related due to the pandemic. There's somewhere else in there, I think it's, I'm trying to find it right now. I think it actually does address facade improvements.
I feel like I've seen
Saw
that.
that too.
I think it's under the parks and open spaces. That's why I'm trying to go back and find it right now. And so the facade is a component, a large component of the project.
Questions under this one? Like, it's comprehensive, and then looking at the different budgets, the scope of work that they've included. I appreciate the detail. It's hard going back between all of them.
I like that the application details the job creation and the economic growth that's possible for the community. I would just be interested to know what the affordable rent estimate is for the 2 apartments, even though they're not asking for funding for the apartments. I'd just be interested in knowing that.
How affordable will the apartment rent be?
Ballpark.
I guess I kind of have a problem when I read, and I'm just looking at what we put in our application about negative economic impacts caused by the public health emergency. Respond to the public health emergency or its negative economic impacts, including assistance to households, small businesses, and nonprofit, or aid to impacted industries such as tourism, travel, and hospitality.
I think that was taken directly from part of the legislation.
It was.
Yeah,
And I don't know if the FAQs really broaden that, but when I look at it, it's the negative economic impacts caused by the public health emergency. That theater's been closed for how many years?
Is it closed? They have shows in it?
Well, pretty much closed.
They have comedy
They
shows?
had like
They
once a
have
month.
shows up there. They were having shows. They
Yeah.
were having shows, live performances.
yeah,
Okay.
Yeah. because I kept getting the emails.
Are they still?
I believe so.
Yes, yeah.
Yes, okay.
I did find that one of
So,
2.18. It's the fourth paragraph now. I can read it. Second, recipients may provide assistance to small businesses. In all communities, assistance to small businesses could include support to enhance outdoor spaces for COVID-19 mitigation, restaurant patios, or to improve the built environment in the neighborhood, example facade improvements. No, I've seen facades in there somewhere.
Thank you for that information, Leanne.
I don't have anything.
That's all I had for infrastructure. Then I just did everything else as kind of a catch-all. Starting with number 1. I think what we had said was internally that we weren't looking at premium pay. I don't know that our application, it specifically stated that. I know that we had talked about it, but I didn't see that our application specifically stated that, but we have said that.
Listed
We
these,
did.
yeah, these are the priorities.
Right, what our priorities are. So, so,
And although they list premium pay, it sounded like they were describing incentives, which seems similar to me as number 16. The one from the United Way, where the United Way is fiscal, serving as a fiscal agent for these other childcare facilities.
Because the premium pay had to be back in the early months or a certain time
For
period in
essential
the pandemic.
workers.
right,
They're talking about going forward. I think they misused the term premium pay. I agree with you.
right. So then I had number 7.
What was it?
Oh, I'm sorry.
My question was, really didn't have any budget detail. And I wondered if they were or could be part of the United Way Child Care Coalition.
Oh, for the number 1.
Yes.
Yeah, they just, in their budget just has,
There's no budget detail.
no, it just has personnel and then the ARPA money request.
They're
was
just
gonna say, could
increasing wages.
Yeah, they haven't been able to save. Wages.
Sounds like they've got a waiting list also.
Sure.
I'm sorry, that was all I had for them. So I'm on this.
Uh, No, I had after 1, I had 7.
Oh.
Yeah, these are just all my
Oh, I
catch-all
can
ones,
check
sorry.
it separately.
Yeah, Sandra reference number 16, but. Did anyone else have that?
I had 7 under food.
Under food?
Yeah, so I've got 7, and 17, sorry. Yeah, 9, 17, 16.
7, 9, 16. And 17? I don't want to get too confused.
How about we can just go through the rest of your catch-alls.
Yeah, because I think I only have like six catch-alls, 7 catch-alls. So the next one I had on it would be 7. Economic relief program.
My question on 7 was the folks that they're hoping to help with the utility assistance, they be directed to the centralized intake through the centralized intake process.
So, on their meals program. um, I don't know if they were providing vouchers or how they were providing, I'm just trying to read.
Is that the one they're gonna contract with the restaurant?
Right, so I do know that through, again, this would be more kind of age specific, but Aging Resources has been trying to reach out in Story County to, and I gave them names in Collins and Colo and Nevada to contact those restaurants. I actually gave them the restaurants' names and stuff to do what's called the Iowa Cafe. And so where they actually get some funds from Aging Resources to help provide meal. I mean, it would help the business out, but would help provide meals for eligible individuals. I know that they've contacted me a couple times because they have not gotten a response from some of the folks at the restaurants to get back to them. So I had put out there to say, hey, I can try to set up some meetings and take you to, to them or whatever. So I don't know if they've had that chance. I'm just trying to think at our last Aging Resources meeting last month. I provided her more information. She was going to follow up with them. So I don't know if she's been able to connect with anyone yet, but that is, they wanted to get something up in Story County going. I think they're looking at least one location to get it going. There could be more locations at some point that this could be done at, but I don't know. They are in the process of.
I maybe heard something about that. I can check my emails and see if I have any additional information.
So,
He mentioned several restaurants in here.
right, he does, and that's what I'm saying, is I gave him the information for like the bistro in Collins, Nyland's Cafe. I hadn't done up to, or whatever, those were, just gave them a few of them, but we're bound to have too many all at one time. But it benefits the business because they are getting some funding as well. But I know they have. I know they had reached out to Collins, Bistro, Nyland's Cafe. What's right next to Farm Ground? The little.
Well, snack shop, snack time.
Yes, that was the other place that they had reached out to as well. And I don't believe the last I talked to them, they had gotten any response from those entities. And that's why I said sometimes a one-to-one versus, finding out who you should talk to versus email
Right.
or a phone call.
Yeah, I could see them not knowing that Aging Resources was doing that. So maybe that's just putting them in touch and seeing
Right,
what they've had.
right.
Why are they only planning to run the program through June of 2022?
Good question.
That I wasn't sure if maybe that's what was the end of their use of CDBG funds for the program. Or, and knowing CDBG is federal funding, making sure that when that end of that funding is reached, so that going forward, ARPA is not.
Well, and I need to get, so our ARPA dollars, so an entity receives any federal funding. And then not use or is it just for a match? You can't use it as the match. That would be a clarifying question for ISAC. planning projects are we receive some sort of federal funding.
I would be curious to know if they've worked with, Renovating the Theater first. Or, you know, how closely are they working with food pantries or other groups that are doing meal delivery? And if they've talked to community services about what utility assistance is already available. Renovating the Theater first has been doing meal delivery, right?
I'm thinking depending on the population, to each department. Thanks for their program. They can throughout their account.
Yeah, that's just that I think there are a number of agencies that have been working to do food delivery and meal delivery. And it's just another example of, these are great ideas.
Right.
Can we bring them together and really have a bigger, longer lasting impact?
Those other dollars and programs.
Right, right.
Right. Yeah, so finding that, and then I can certainly check with aging resources to see if they were able to make that connection. And if not, you know, call down there and just say, hey,
Right.
they've been trying to reach you. Are you aware of this program that is very beneficial to your
Yeah.
community?
Working with another agency is certainly, because you start up a new program, you've got so much volunteer time that's going for getting that program going and getting all these things done that others have already done. Yes.
I mean, it sounds like they've done it something similar in the past, so they have some experience, which would only be more of a positive coming together with others who are doing it currently.
Any other questions here? And I have next would be number 9. Let's do this first.
At their meals served in 2019 compared to their meals served in 2021. It's staggering.
Yeah.
35.
Like 5 times.
And those went from in-person in 2019. to two different, entirely different models too.
You notice that the first full evening meals, the objective was components to increase the number of evening meals delivered and expand the geographic reach of conveyed food first. Part-time contractor to support meal delivery in all 6 eastern Story County communities. assume that's zeroing. It's Colin Maxwell.
Yeah.
Hollister. See, now that would.
So households with children and the aging. I don't really have any questions on this other than their willingness to collaborate
Right.
with others.
So it says the goal is that all households can access free residence twice a week. When we looked at Collins, did they talk about how often they thought they would be able to?
But yeah,
Right?
yes.
So,
That might be a question for Colin, would be how often. Yeah, yeah. I'm looking through and I don't see it.
Okay, we go back to the Collins on this.
Collins has the extra kind of overlay of support for small businesses, supporting the
Right.
community in that way too. That's right, man.
Well, then they were wondering when the beta deliveries were.
I can hear you.
Were you wondering when just Collins, how many times a week and days Collins went out, or just both Collins and the beta?
The beta said two.
Yeah, they're Monday and Thursdays.
Okay. Now,
Yeah. The beta is Monday and Thursday.
so their goal was 2 nights a week.
That they are. They increase their into other communities.
But they're not increasing the number of days, they're expanding to other communities. Is that what you're saying? I'm confused.
Yeah, Collins, I'm not sure if it's a, eligible folks have a voucher and they can just go, they make that determination, is it?
He didn't say.
No, it doesn't, that's, right,
How would you, oh, so another question for Collins is how would you determine?
right, eligible or,
Or even what's your delivery, what's your, how do people,
access the meals.
yeah,
Is it going to the restaurant? Are they delivered?
They said vouchers would deliver.
Yeah.
Deliver, but how often
Yeah.
is that?
And do I just call the bistro and say, I would like to order XYZ? When I,
It said that the city of Collins would handle the administrative details.
And I do know that Brett did talk to me at one point and said they had did something that references it in their application before.
right,
That was several months ago, that he just said, hey, we did this program when people were, everything was shutting down, it kind of helped the businesses, but it also, we made sure that people were fed. I don't know how often that occurred. It may have been different during that particular time frame when you had, when everything was shut down. That may have been the difference for how that was run versus how they might run it going forward.
And they may be assuming we're familiar with their program. We don't.
Right. He just gave me a very high level, hey, we did this versus the more the in-depth of how they ran it and how they administered it.
Did we include an eligibility question for number 9?
For Nevada,
for food at first.
No, 9 is, how do you determine eligibility?
As far as I know, food at first doesn't have any eligibility requirements. If you say you're hungry, you eat.
right,
That's where the minus and A's.
right.
So maybe they're doing the same.
I think so.
Yeah, there are no questions asked.
No.
Would that be? Would that be okay for ARPA funds? That anybody could be eligible for, would it need to be specific eligibility determined, like low income, something within a qualified census tract or something like that?
So that might be an ISAC question, is if they fall under that qualified, if they're located in that qualified census tract.
That probably would be okay, but
If they're outside of that,
that is where I
would,
think
would, would they be eligible, or would there have to be a eligibility determination done to qualify?
Question for ISAC, there's no eligibility requirement of this program. Could they get ARPA funds?
One, what I have left on my list are 16, 17, and 21. That we have not. So number 16, which is for Story County Child Care Coalition.
I was involved in a Zoom meeting early on in this, just to talk about the problem of not of the child care centers having getting and retaining workers, but I wasn't part of the application process.
Yeah, and I was at a meeting where they were discussing it, but I also was not part of the application process.
Yeah, and on chapter, I've been in other meetings, but it was months ago related to childcare, had no connection to this, and that was more just identifying the needs in Story County, which is probably about a year ago that I was involved in that. So I've had no recent.
June.
Yeah, 16.
But I didn't have dual monitors in here, it's going back and forth. I volunteered to do this. Um,
I feel like this proposal is trying to address the overarching need rather than each individual center addressing the need themselves, which is kind of what we were talking about with food and housing.
And this is the one that we thought maybe could also address some of the issues raised by Whistle Stop.
It says the coalition is nonprofit. I just noticed that. Whistle Stop down a nonprofit, is that why they're not involved in the coalition? Or did they just get overlooked or decide to go their own way? I don't understand.
I don't know if this is stuff that's not happening. I don't believe they are.
It says under the purpose statement. The Story County Child Care Coalition consists of DHS licensed nonprofit child care centers in Story County, ACPC, Storytime, Maxwell, University Child Care Names, and YSS Kids Clubs in Slater and Polo, and 2 sites in Gilbert, Story City.
Whistle Stop is privately owned.
I can't hear you, Alyssa. What did you say?
Whistle Stop is privately owned as far as I
Thank
know.
you.
Gotcha, gotcha. Um, Yeah, I don't know if all these. So, for example, I don't see like Eagles Walk, is that privately owned as well?
And like Lily Pad.
Yeah, and I'm thinking like Child Serve, they have childcare leave as well. I'm just trying to figure, or do they just have some folks that are represented, or is it all? Is this identifying all? That's what I.
Right, or
that's
is
what I'm
this just,
clear.
are these just the ones that said, oh, that sounds interesting, we'll participate in
Yeah,
that?
yeah, that's.
Does this group represent include all nonprofits or all? So,
I can't hear you, Leanne.
Yes,
Oh, okay.
these are all asset funded agencies.
Is this incentive pay?
I think so.
I viewed it as.
Incentive pay?
It's not premium pay, because that would have been in arrears.
It's incentive and bonus pay.
What's a prime approach, referral bonus of prime employees. Signing bonus, final bonus for new recruits, and retention bonus for all employees over the next 4 years. Coalition would develop the structure for how each of the 3 referral incentive bonuses would be approved. And that is what it serves as fiscal agent.
So there was a school shooting in Michigan, two students. Um,
Thank you.
I guess my question would be, and maybe that's when we get to deliberations portion of, is that something we want to do is fund incentive or bonus pay? So I'm not asking for a response, it's just me speaking out loud of for consideration.
You're not saying it's not eligible.
No, I don't know that it's not eligible. But I was thinking there was another program, well, the MICA one,
There are a couple.
that also had like incentive or incentive pay for retention. I think there was another one as well, so I'm just pointing that out, is some of them, they meet, probably meet the general criteria of eligibility, that's just later of a conversation.
And I don't know if they have in this one, how they would, fund the wages ongoing. I do know of a similar program they did in Hamilton County. And what their rationale was in terms of doing it is that if they could get more workers, they would be up to capacity and they would be making more profit. They would be able to, in a few years, sustain the wages.
Like the primary healthcare.
Exactly.
I think they have great difficulty competing for eligible workers.
Oh, sure, yeah, no, certainly, I understand that.
Pay is remarkably low.
Yeah, right,
Pathetically,
right,
what
yeah.
they can afford is just pathetically low, and
Yeah, I'm not questioning that portion at all. Other questions that we had for this one?
marketing 36,000. Did they really talk about what they would be using all that much money for? Or how they would market? Work with other communities, local and regional employers, Iowa Women's Foundation, and local. That's range. And stock prices.
I don't think it's clear on what they mean by marketing or for marketing it.
The only item I've seen is create a marketing subcommittee to develop strategies to reach potential employees. So that I think there's going to be design and sending out. I mean, I don't know.
Yeah. Yeah, that may be something, yeah.
Yeah, that's all I.
Okay. Okay.
Down there.
So I'm not sure.
That's fine, yeah, I'll wait.
Does this group include all the nonprofit childcare centers in Stewart County? Do you want to ask about marketing or that?
I think so.
Yeah,
Yeah, I think we want, yeah,
What ideas do you have? for marketing?
36,000 is not, it's not like they're asking for 3,000.
right.
It's more than just printing.
what is
I don't know
it,
if it's
$36,000
over like 3 years
for
or how many
marketing?
years,
Yeah,
you know.
right.
Yeah, exactly.
It might be the time
1
frame,
year, 3 year,
'Cause I know publication costs are not, they've really gone up,
right.
so that might be.
Got it.
Oh, and then when you, did you say you, how do you determine retention and who gets,
They said they would work out a system that everybody would use. They didn't
Okay.
really
they
say.
didn't say there
They
was a
said-
system yet.
Yeah, they don't have it.
Okay.
They would work with, childcare centers to put together something.
The next one is number 17.
And that's like benefits.
Correct. Question.
Right, right. Let me just ask a question. Just doing more of the same, or is it very different strategies? They are funding two things. right now.
Right.
The 211 support seems to be different. They're trying to, almost sounds like a one-stop shop of information. One-stop shop information and referral process. That's what it sounded like.
But it's not with individuals, it's with the food banks.
It says social service programs.
Yeah,
Yeah.
211 is, it's different. It is like a one-stop shop.
I was looking at the emergency food, not the supports.
Emergency food, they look like they're creating an online grant application.
That's why I was asking for that. Are they talking about the food banks? It says developing informed forms for grantees to collect data.
I think they're trying to improve what they already do.
Process, it's process improvement.
Yeah.
That's part of to better see the utilization of those dollars or amenities within the local food bank, so that they have more specific data.
Yeah.
For Story County to really get a better assessment, more in-depth assessment of what the need is. That's,
I think that's exactly it.
I
Yeah.
think that's what they're trying to do.
211 is a United Way webpage. So does each different United Way need to have a contractor handling information for their county?
For emergency food, it does sound like they're going to be providing grants for that, and I know they already provide some grants. So this could be providing additional funding for what they've already do in that part.
Can't look at it, Comcast is blocking.
Put in 211iowa.org.
I went to that site blocked. Did you get it?
Yeah, I've got it up.
I think, yeah. Sandra, where are they, what, do you know which page they're talking about additional funding to? Or is it in their budget?
Is it page?
We wanted to see something.
Oh, I do.
Wanda.
15, page 15, where it describes the project goals and objectives. It doesn't say additional dollars, it just
Okay.
says grant dollars.
You got it?
Of this component of the grants to decrease food insecurity in Story County. Grant dollars will be used to support Story County's 20+ food pantries, food distribution programs, sample backpack program, food vouchers, et cetera, et cetera. Is that what you're talking about, Leticia?
Yeah, yeah, thank you.
So you still have the question of is some of this provided?
Yeah, I mean, yes, I still have a question. Is some of that for actual to support the food pantries, or is this? To improve their data collection?
I'm looking at their, we input up on the screen, food distribution, the backpacks.
That outcome section is pretty well thought out. Annika is the one who is in charge of scorecard, the tool that asset uses to track outcomes. I'm sure they probably already do some of that tracking.
So it looks like from the budget though, that they are doing distribution of food.
That part
To
is-
me,
Yeah.
Yeah, to me, it's a little unclear when you reference what looks like more data collection and then looking at this to try to make those two kind of match up. And it might just be how I'm reading it.
Here's what I think I'm hearing you say. Is the goal to increase food distribution or provide better or distributed or to provide better or to collect data better.
That, I think, yeah, I think that captures it.
Okay, and when I got on that website, it talked about United Way of Iowa and Nebraska.
Right.
So does United Way of Iowa and Nebraska update the 211 site, or do you need somebody locally to do it? Is that-
Well, United Way of Story County is part of, but separate from United Way of Iowa. And so I guess my question is, does United Way of Story County have to have their own person uploading and updating information on the 211 site? And is that what that position is about?
Or is it the individual agencies update that information? Because I don't remember. I don't remember the individual agencies that go in and update that information. No, updating my agency and just clicking on. It's like you update your information.
Print materials.
So extension.
No, what they're doing, they're not updating the data on 211, they're promoting 211. Right? That's what I'm getting out of how the success of your project will be evaluated. Number of 211 print materials shared in the community, number of entries added, added and or edited by our, I guess that is one part here, they added. Request monthly reports from Iowa State Extension. Why do they need to do that? Why isn't 211 giving monthly?
ISU Extension is the entity handling it for this region.
Oh,
Yeah, when she just went
Okay,
over it,
gotcha.
she just went over it and showed
I
that.
didn't see that, okay. Okay, gotcha.
On page 8, it says 211 supports. The goals of this component are to strengthen the 211 resource hub for Story County and to increase knowledge and utilization of this free 24/7 information referral system.
Okay.
It will be achieved by hiring a short-term contractor to ensure complete entries for the range of human services programs in Story County specifically, and to test the availability of accurate information through various modalities. And B, by printing 211 marketing materials to distribute to human service partners, clinics, and other medical providers. And C, by placing advertising on public transportation.
I wish we'd asked for problem statements. I'm reading a solution, and I'm not seeing data on what the problem is. And I think we didn't ask for a problem statement. I wish we had.
Well, so the need for this resource has increased due to the pandemic, as many households have faced new financial strains, mental health challenges, and beyond. Exemplifying this, the COVID-19 resource page created and hosted by United Way of Story County received 10,830 views and 5,296 unique visitors since the pandemic began in March 2020.
But partner agencies testify the site became the go-to. Partner agency sites, because they're not certain one can keep up with quickly changing landscape. Social services. Really. got lost in those numbers. Okay, more calls were received. Is that what you're getting out of this? We're talking back and forth on years and months here. I'm trying to figure out, are they saying more calls are now being received on 211?
Yes.
Yes, and sounds like more people are using it as a go-to resource. It's being viewed as a valuable resource.
Okay, so people are using it, the use of 211 has gone up. Why do they need to market it? Use is going up.
Probably to make sure everybody who needs those resources is getting the information.
I don't know if their data, you know, like they can see that they're getting 10,000 people looking at their site mark. Can they see now? I would say probably not. I was trying to figure out, can you get like, you know, are they Ames residents or are they like more in the rural area that are looking at that? I don't know if they have that, you know, it's, so would that give them the marketing to say, we need to target
Specific areas.
yes, specific areas of the county, because they're all being concentrated in Ames only, looking at that information. And that I don't. That's the lack of techie side of me. That's a possibility to get that information.
In terms of who is being served, then they already have that type of information as to who's actually coming to get the services.
Sure. Has that increased?
And where are they coming from in this rural area.
Right.
So the 211 person position that they're talking about is a short-term position. I guess one question would be who will maintain it once that short-term person is no longer there? They're gonna get everything updated and test everything, but that's an ongoing responsibility for somebody.
That would be more of a, like an intern. Just looking at their budget. That's 17,000 for personnel and 12,000 of that's in kind. Or is it just so that folks can designate, their current folks designate some additional time towards the project? So it may be just have to get it to a certain level and then the plan is just being absorbed into their daily, you know, their daily work or just looking at the amount that's put their request in the in-kind. That's just my thoughts. But that might be a question is there a need for ongoing personnel? It's just unclear.
I think I need to read this application again before. I get more confused the more we talk about it, honestly. Maybe I need to know more about 211.
a lot of
There's some additional information on the back about it. Application for the budget page.
The map that you were displaying, Leanne, what were the regions? I was not looking at it because I was reading. These are Iowa County 211 service areas. So Story County is included in which, in the Northwest region. So does that mean, what does a 211 service area mean? Do we know? I mean, it's not like you go to 211 if you're in Story County and you get information for all those counties. It's that Iowa State Extension administers it for all of those counties that are in the goal. Is that what it means?
Yes, I think so.
Okay. So I wonder what that means that Iowa State Extension actually does versus this coordinated thing will be higher. Just curious, could you hover over the red area? United Way of Central Iowa administers that, okay?
This is the United Way.
Of Midlands.
City.
So United Way does some, Iowa State does some, Worksession does some. Right. I guess that's the question, is what is, yeah, that is my question. What does Iowa State Extension do? Yeah. Not do as administrator. I can need that. For this project. Is that
That's a good question.
That is a good question. Right. Any more questions on this one? I have as our last one, it's number 21. That is the cultivating careers, it's Project Iowa. Yeah,
So it says it's an 8-week program. It doesn't say what, it says it's 4 days a week, 1.5 hours a day, and it's virtual. It does not say what the course consists of or what people are trained to do. Unless I really missed something and read it way too fast. What am I missing?
I was wondering about the curriculum as well.
That same question?
Yes. It sounds a lot like the program that the board approved for the chamber.
Right.
What the board, what we approved for the chamber
Workforce
is,
training.
yeah, with DMAC is real skills training.
Right.
I get the sense this is not skills training, and maybe, I get the sense that what it might be is getting people ready to be employed in terms of things like,
Soft skills.
soft
Yes.
skills, exactly,
Yes.
but it doesn't say it.
Yes.
Right,
No, it just says career training and then helping them find, assisting and helping them find a career.
right.
So-
So it doesn't specifically state which which discipline?
Well, that-
You
that's
know,
just it.
is it broad for anything, or are they targeting a work entity, or is it the soft skills, you know, how to do the interview, you know, those type of skills so that you can then,
Yeah, but they just, yeah, and they don't say,
right,
that's the whole thing.
right.
They don't give any idea about that.
Sounds like they're targeting a certain audience. And from that, you kind of infer that that's where they're going with it, but it does not say that clearly.
Yeah, from what I know about the program, I thought it dovetails really nicely with the program that we approved with the chamber. I think there is a large population of people who just are not ready for training, for actual training. They need that extra support to get to that point, and I think that's what this program addresses, is that population.
Project Iowa wants to offer Story County residents our free 8-week training, career training program. But we need $100,000 to offer the free program.
They also provide wraparound services similar to the
They do.
workforce retraining initiative.
They said it's about $5,000 to recruit, train, and provide employment placement services to one.
They provide a computer if someone needs a computer.
We're doing 20. They want, provide the funding to train 20 individuals over a 2-year time frame.
So so if this is soft skills, if this is people who just aren't ready for the job market, get them ready.
If somebody that wants to change careers, this is what it sounds like.
Well, I guess they need to
More.
tell us more.
Yeah,
Does it say what the 8-week program is?
Pretty general. There's that, I don't know what that video is, but. Not that I can't see the details.
I think it's a lot of personal development.
And am I right that it said it would be done virtually?
Yes.
It's a virtual program.
You've got to be pretty, if you're in this category of folks, you've got to be pretty motivated to stick with a virtual program. And maybe that's just my thought.
I thought I read where they had somebody working directly with individuals on their career goals, and so maybe that's like a coach or mentor or something. That could be a question.
Yeah, I believe they used to do it in person, and then with the pandemic, they switched to all virtual. And it's my understanding they didn't see any negative impact on the people who are participating.
And this could get more participants,
Right,
maybe for single parents who don't have childcare.
sure, right.
Sure. I just think they have, what was it? I'm just trying to look at my notes here. They had a completion rate 85% or higher. They have a,
9% employed in multiple wage careers.
what percentage did you say?
More importantly, 79% of all our graduates are employed in livable wage careers.
Okay, yeah, I just found that. I just read it.
Mhm.
My main question was about duplication of the other program, workforce retraining initiative, but Lindsay provided some good information about that.
Yeah, I think this is a different group of people, or this group of people could then move into that training program. And have a higher likelihood of success in that program because they had all the support they needed to get there in the first place.
Preparation.
Yeah,
And it's probably likely that people don't originally get referred to the right place. You know, because somebody might be self-referred or referred somehow to the program that the chamber is doing. And this would take some real coordination between them and this program. To say, we got somebody, we don't think he's ready to go to DMAC for a hard skills course right now, because we put them through your program. So they'd have to be working pretty close together. So I think we want to talk to the chamber about that before saying, yeah, you know, it's like they both have to be willing to work with each other. They'd be the front end, they're trying to put front back.
right, exactly.
And Linda, did you say in your questions you were looking at just a little bit more specifics on curriculum?
A lot more specifics.
Just,
Yeah,
What does the course consist of? What do you train them to do? Is this soft skills? What are the skills? That's what I've done.
yeah, okay.
And Sandra said, and you said there are wraparound services.
Yes, they do mention wraparound supports, one-on-one staff member assigned to work with them towards their career goals.
Okay, so would you be willing to be the, on this called front end to our workforce retraining program? And it might be good to also ask the chamber right now.
This probably doesn't have anything, but, so they get them trained, is there any follow-up? After they get them trained, find that job, is there still continued support?
That's good.
that's a good
I mean,
question. That's a good question. Is there
Support
any
people.
ongoing?
Or at least a check-in
after.
6 months after, you know, just that follow-up. I don't know,
So it's job retention as well as, job
Yeah.
retention.
keeping them in
Don't
these
stop at
positions,
placement.
you know,
Right.
giving them supports they need to continue on.
Right.
Right.
In that, yeah.
I don't know, I know it said that they've got someone assigned to them, but to what extent is that person? I mean, are they checking in? Is it weekly? Are they meeting with that? A little bit more specifics or details as to what, at what level or, I don't know, I almost want to say, how many hours are you? I'm assuming it's
How
really
much,
individualized.
how much support is given
Yes.
by your personnel to each program participant? I do it?
Yep.
Yeah. 3:30.
Any other questions for this one? Looking through, I believe we've gone through everything on our list here.
Did we do 23 before?
Um,
Yes,
so,
we did.
yeah.
Yeah,
I have it on different pages. Prairie Rivers, we did.
What?
Thought we did that yesterday, Leanne.
Oh,
Yeah,
yeah.
23 was the Micah one.
So the living?
28.
Oh, okay.
We got them all?
I think we have them all.
I think we did. Okay, I'll send everybody the questions that I got. I just was trying to do it, but you know.
So I'm just wondering, working with staff and stuff, so we've got all the questions. I'll merge Linda's questions with mine. I think we've identified which ones should go to ISAC. Well, I guess kind of my first thought was I was going to email them out to make sure we captured all the
Yes.
questions that we have. And I think our system's going to be down tonight, so I've got most of mine together. We'll merge it so that you can get out and take a look. can. And then the ISAC questions, I can then send off to ISAC. But we'll need someone to send off then to each of these entities and stuff so that we can get those responses back. So we'll just have to figure out, right. I think we have pretty much everybody's email with this, and we can just say these are some additional questions that we have. The questions will be set
We'll just be a
So
matter
it's
of
just-
copying, pasting them into the.
to the email.
We could divide those. That's the way Lisa Markley and I did. She took
Took some-
conservation and I took facilities management and IT.
Yeah, and I was just, I didn't know if we wanted to leave them all, or if it's better for me to just take what we have and put them 1 through 37, in there and just send them out, if we break them apart, how you break them apart. I mean, right now we try to do by a category, but you're gonna have to, you can't categorically send all of them to the same one, is what I'm saying. So that may be just something to figure out later so that we can get those questions out. And then I would say we've got our next meeting date for December 10th. It would be nice to have those responses back prior to then, if we could even have them by the 8th or earlier.
Yeah, that's a week.
Yeah, would be kind of my thought. That way we could go over, we'd have those, we could go over, time to review those
Before our meeting.
before our meeting.
And then we have 2 meetings for next week.
Right. We don't want to wait till the December 10th meeting to then figure out if there's anything else in there before, are we, because we've got as you said, the 2 additional meeting dates, or do we need to look at some other potential future meeting dates with our calendars?
I think wouldn't hurt to maybe just have one more in case. Do that.
I think that's a good idea. If we just get them on the calendar, then
It's
it's no
not cancel
surprise.
a meeting, but try to find a time.
We've got December 10th. We have December 10th on our calendars and
16 and 17.
16 and 17 on our calendar.
The 10th, I have a meeting in the morning in Webster City. I've got an executive committee meeting of that board after that. I'm not sure I'll be back by 1. I'm a little worried about that. But I thought it was just a full board meeting, and then I got a notice of the executive committee meeting.
Well, I'm not sure the rest of you, I blocked 1 to 4:30 for that time.
Yeah.
I
Moved
did,
it for
but
later.
could we make it, I'll try it, let's make it 2.
Sure.
I didn't realize that they were going to slip in executive committee. And then we have the 16th and the 17th.
Right, we have a full set at 8:30.
So 12:30 is what I've got.
Right, not if we use it, I have 8:30 to 12, but it could be till 12:30. I can do 12:30, that's fine.
I think it's just on the calendar here. Got a hold on 14th for housing.
That's when you set the housing work session.
If that is the housing
think-
session.
Yes.
And what
Okay.
time is that out on the 14th? 2 o'clock.
2 to 4.
that's not available.
So cool. The week of the 20th.
I guess at first we should probably find out if anyone has vacation days scheduled.
Right, well, that's, yeah. And,
I marked off the beginning of the week of the 20th, hopefully to schedule a marketing session. I'm trying to get that worked out, but we've got one contract open, which means I'll have to meet with the board prior to that. I'm just trying to get a few things.
sure,
So I do know the week of the 20th. We could schedule some time. I just to get it on the calendar so that I'm working with a couple other attorneys in the union.
Did you have any idea what days might?
No, because I was gonna send him the 20th, the afternoon of the 21st, the 22nd or the 23rd. Just because he said throw some dates at me. I mean, I have no idea what he has open yet.
Well, what if we, you haven't sent him any dates yet? Right.
Sandra and
No.
Leanne, what are your schedules looking like for that week?
we don't have like the mark late, no.
I would think the 23rd is the only day that I was thinking. Yeah, so I'm not sure.
Does the afternoon of the 21st work?
That'd be
I know-
okay.
I know you don't
No, I
have an
prefer
answer.
doing like the afternoon of the 21st, so I could keep the possibly
Uh-huh.
the 20th, so I have a full day. If that
Sure.
works for the union, we could just start in the morning and
Right.
bargain.
Well, and I was looking at the 21st, I'm like, it's a Tuesday, and
Yeah.
we're all already usually.
Those are
generally
bad
like
days. I try to
volunteer.
stay away from Tuesdays unless we go with the afternoon.
Would have to leave at 3:30. I'm not very available on that day, on the 21st. Is that what you're talking about, Tuesday, the 21st? I've got a personal appointment.
But if you look the next week,
And
Those are slim.
yeah,
Could be-
there's
I
probably
mean,
a lot
I'll be honest,
better.
if I
Yeah.
take any time off, it's gonna be a day or two, but based on staffing levels.
Right,
And-
right.
Yeah. But I just know a lot of people are out.
what about Wednesday, the 29th? People are wanting to take like Thursday to go with Friday for the New Year's, or wanting to take Tuesday to go with Monday holidays.
Might be on that Wednesday, and Thursday. Those are the 2 days that I've got just tentatively marked, but
Okay. Or
I
you
can
mark
zoom in.
Wednesday and Thursday off.
Tentatively.
tentatively, depending on staffing. But we have some staff out that week.
Maybe we should just go back to looking at December 16th and 17th and say we're just gonna, I have the afternoons free. No,
Oh, I'm in November, I'm so sorry,
for December 16th, 17th, if we just gave ourselves an hour break, gave ourselves a lunch break, came back,
Oh,
That
and just
stays
kind
away
of did
from-
all day?
all day, that stays away from the holidays and gets it done.
That work? I have a Hubbard collaboration on the 16th, but that's all I've got. So
I actually, okay, sorry, I gotta look, because I don't know if I have a CICS meeting or if they're not meeting December. I'm pulling it up because I just don't recall.
Sandra,
I just want a couple hours. I mean, can we do like a 6-hour instead of the whole, just to get, there's a lot of reporting stuff we have to do in December, so, which is fine, we'll work it out. It's just 2 full
Oh.
days back to back might be.
Yeah, and that'll be the other thing is if we're wanting Lisa Markley, would she be able to,
I don't think I have her. I do have.
would she be able to do, a full day? Or
She's a
could she be?
Budget, she's putting budget stuff.
Budget
together,
stuff
so I don't
together,
know.
right? Yeah, so our next CICS meeting is December 16th.
Okay.
So that's gonna be in the afternoon. 1 o'clock. We usually go from 1 to about 3.
and Latifah, was your meeting on the 16th?
Yeah, that's
What if we
right.
look at the 17th and do that for 8:30 to 2:30, try to do that.
extend that time.
That gives us a few more hours. I think there's really gonna be some. I think this is gonna be more of a difficult process than we might want to think.
Uh-huh.
That's why I'm
agree.
concerned about us having
Yeah,
there's a whole bunch of good programs. There's a whole bunch we still have questions on.
How does Monday afternoon, Monday the 20th?
I'm good on the 20th.
I just hit my calendar. I would be good on the 20th as well.
In the afternoon.
Yeah,
Like at 2?
2 to 4:30.
I'll put it down, but I might, that's my main.
Oh,
That's
that's-
my
that's
main
right.
day. I'd like to schedule
It's-
bargaining if they're available, but we
Right.
might be done by 2. I mean, it's just,
But instead of the 21st, trying to stick
I
on
think,
that side of the week, so you still have Wednesday and Thursday open.
right, but if she's doing bargaining, looking at bargaining, she might need the whole day, is what I think what you're looking at, is that correct?
I typically block off the whole day. I don't even know if the meetings, I'll put it on my calendar, but just, I might have to miss if I can get everything scheduled for that day.
Well, if everybody else can be
Yeah,
here.
I'm not
that day.
worried. I'll just get filled in, that's fine.
Yeah.
And there's Zoom, you're doing it via Zoom, so I can go back and watch.
Okay, 2 to 4:30 on the 20th.
Just got some other dates on the calendar.
Dates and a couple of-
Right.
Yeah, I think that's good.
What were the other times? 2 to 4:30 on the 20th and 21st we scratched.
Right, and the 17th, we extended that to from 8:30 to 2:30.
And the 10th, we're not starting until 2 o'clock.
Right, instead of 1 o'clock, it's starting at 2.
And the 16th is still
As it was.
As it was,
till noon.
correct.
Mhm.
And if need be, I excuse myself from the 100. It looks like we need to meet on the 16th after.
Yes, yes.
meeting.
Yes, will probably be a longer meeting, no longer,
I don't have the agenda yet, so I can't tell you.
but they usually.
You're usually pretty close to 1 to 3. It wasn't like the last thing where we had a lot of discussions on that 28E and the bylaws that we didn't get done until 4 or so. So. Okay. Anything else before I open for public comment? All right. Now open for public comment. What we've got. Okay, so,
Would it be easier if I just spoke?
Laura.
Okay, hi. I undo. Okay, I want to say, first of all, that again, thank you to the 3 of you and to the staff. This is an incredibly laborious process, requiring a lot of time from you guys at a season where, yeah, people have vacations, there's end of the year coming or whatever, just so I want to acknowledge it, even if nobody else does, all right, on that. So thank you for that. And then I just had typed in there about the question about, ADA accessible. That's my fault. I didn't use good language. 2 of these units will be completely compatible for someone who's totally wheelchair bound or quadriplegic or whatever. That's what we meant. All right. Of course, the whole building is going to be ADA compliant. If someone's deaf, we'll rig up a doorbell for them, that the light flash, etc. So I'll reserve the rest of any comments to when I get the questions from Sandra. I wasn't quite clear a couple of the little issues, but I'll read them and then look at them. And so, yeah, with that, just thank you so much, you guys. This is just got to be exhausting for you. Thanks.
Thank you.
Thanks,
Thanks,
Laura.
Laura. Were there other folks who want to make public comments as well.
I know there were a couple of comments I was trying to go back and forth from sharing. I was delayed in getting the document shared, so they reminded me to do that.
Gotcha.
Again, people are saying having issues hearing us all.
Yeah.
I think the masks really are affecting that, and then making this available to the public. In summary.
Anyone else here in the public meeting room or online that want to unmute themselves? Okay, does not look like it. So looks like our next meeting then is going to be December 10th at 2 p.m. If there's nothing else, we'll adjourn the meeting. Thanks, everybody.
Thank you.